Welcome to Chapter 1, Aspects of Medical Surgical Nursing, MedSurg 1. I'd like to just take this minute to tell you a few things that you need to have before you listen to this lecture. 1, pencil, highlighter, pen, paper. Have your book with you. If you can highlight in your book, that's great. Some people may have a real book that they want to highlight in. You can take notes, because some things I will repeat, and it's not because I'm old or crazy. It's because I think they're important. And it's a fact that you need to hear something about 3 times in order to really learn it. So that's why we have this didactic class, we have a book to read, and then we have you do some clinical things. And these 3 modes of learning to just build in your brain, so it will just come naturally. Also, if I say something that's really, really important to know, believe me, it's important to know. So take note. Also, I'm going to talk about Chapter 1 here first, of course. It's really important because I've been a nurse for 45 years, and I'm also an expert witness for the BVMPT for LVNs. And some of the things that I've heard and seen that nurses have done, LVNs have done, is mortifying. I know they didn't learn it in school. Somewhere they picked up a bad habit. So if it's not in your heart to be a nurse, if you're in it for the money, it's a hard road, okay? You need to really want to do this because there's a lot of aspects of nursing. It's not just taking care of a disease. There's much more to it than that. So because of these experiences that I've had, I'll be telling you some stories that will hopefully help you pick up some of the information, help you remember the information. I'll also throw in some laughter so that we can not take ourselves too seriously, because laughter is the best medicine, and that goes for our patients and for us. So we're going to identify the most appropriate source of information about the roles of the licensed vocational nurse or licensed practical nurse. Now, they will be saying LVN, LPN through the whole book. And that is, LVNs, that's what we are. In California, we're vocational nurses. But where I took my original license in Illinois, we were called practical nurses. So it's really the same job. It just depends on what state you're in, what they call you, an LVN or an LPN. Describe the essential knowledge and skills needed by the medical surgical nurse. So we're going to learn a lot about the knowledge and skills that you're going to need to be successful and to possibly save someone's life. Describe principles of ethics that may apply when caring for medical surgical patients. And I will probably be giving you an assignment about something like this. Also, I'll tell you an ethical dilemma that I had one time, and it will make you think. Provide examples of nurse behaviors that violate laws governing the profession. These are the behaviors we want to stay away from. Describe the characteristics of effective leaders. And you are going to be a leader. You might be a team leader. And you will learn about that in Mod 3. You'll learn to be a team leader. What does a team leader do? And you also manage. You manage other LVNs. You manage CNAs. So we're going to learn about that. Describe essential elements of delegation. How do we delegate different jobs? How do we know to delegate? Who do we delegate to? We're going to learn about that. Describe the following in relation to the LVN as a manager, making assignments, your accountability, and conflict resolution. Now, conflict resolution just isn't amongst each other, amongst your nurses. It can also be from within, a conflict that you have within you. And of course, safety. We want to be safe. So the Academy of Medical Surgical Nurses, or the AMSN, they establish the scope and sets the standard of practice, the standards for nursing practice. These are professional organizations. I'm starting on page 1 in your book, so I'll keep tabs where we are so that you keep up. I'll tell you where I'm located, okay? There's also the National Gerontologic Nursing Association, because a lot of the patients we take care of are elderly. And when we learn about diseases, we learn about what happens when a patient gets older or with aging. We'll learn a lot about that, how things change. Now, this Gerontological Nursing Association is concerned with clinical care of older adults across diverse settings. Now, you can choose to be that as a specialty, specialize in gerontological nursing. You can get a special degree in that even. But it's really important to remember about that AMSN, the Academy of Medical Surgical Nurses. It's the professional organization. Here I go, repeating myself already. It's the professional organization for nurses practicing in medical surgical settings. It establishes the scope of practice, what you can and cannot do, and sets the standards for nursing. The AMSN welcomes licensed vocational nurses as associate members. So now we'll move on to the roles of the LVN. So it varies from state to state, so be sure you check the State Nurse Practice Act where you are practicing. And the certain kind of nursing that you can do would be a caregiver, a care coordinator, a patient educator, a case manager, counselor, patient advocate, consultant, researcher, administrator manager, staff educator, or expert witness. Now you can see there's so many things we can do. So don't pigeonhole yourself into just doing one thing. Know that there's a lot of different things that you can do, and just you have to find what's right for you, what you enjoy. Some roles require collaboration with a registered nurse, so most LVNs always work under a licensed registered nurse. Sometimes you may require special training or certification to have certain jobs. Let's say a PICC nurse. The PICC nurse takes special training. She puts in a PICC line, which is a long-term IV, peripheral internal catheter. Also, you might be certified, IV certified, or so that you can give IV medications or hang an IV. So special training. I did a special training on learning EKGs so that I could take care of telemetry type patients. So whatever you find your passion for, take a special class. Dedicate yourself to being the best at something that you love. So there's some practice settings in acute and subacute care facilities. You can work in home health, ambulatory care clinics, outpatient services, residential facilities, skilled nursing facilities, medical offices, adult daycare, primary care schools. You could be a school nurse. Correctional facilities. I have quite a few students who've gone into the correctional facilities and worked and find a lot of enjoyment in that. It's something different every day, that's for sure. And also private businesses like Wente Brothers hires nurses to help care for their employees. Not only basic health, but also if they get injured on the job. So there is a lot of things for you to do. Now I'd like to point you right here to go to page 2, where it talks about the NAPNES standards of care and educational competence of graduates of the LVN programs. So this is really important for you to know these. So let's look at them. Professional behavior. Professional behavior within the scope of nursing practice are characteristics of adherence to standards of care, accountability for one's own actions and behaviors. Professionalism includes a commitment to nursing and a concern for others, demonstrated by an attitude of caring. Competencies, so there's certain competencies that you need to learn, and that is where the schooling comes in. Communication, very important. Oh, so important in your nursing career. So, and how do we communicate? Not just verbally, but writing things down, right? You've heard the saying, if you didn't write it, it didn't get done. If you didn't document it, it didn't get done. Documentation. It covers you to show that you did it. It also covers you to show how the patient was when you left the patient. So if something happens between the time that you see a patient and someone else sees a patient, what changed? Well, they'll know because they can look back at your notes and see what you saw. And then they can make a judgment if there's been a change in care or a change in their condition. So effective communication demonstrates caring, compassion, cultural awareness, and is directed towards promoting positive outcomes and establishing a trusting relationship. Now, we do communicate on the nursing care plan. We also communicate in an SBAR type of form when we document. I'll get into that a little bit later. So we want to be sure and document. Okay, a case that I had recently. A guy who was an LVN, he was the charge nurse. He was given a report. He went and peeked in everybody's room, right? And this one particular patient was sleeping. Well, that wouldn't be unusual at 7 a.m., right? But the CNA took the patient's vital signs, and the patient didn't wake up. So she went and reported to the LVN, the charge nurse, LVN, that the patient wasn't waking up. He goes, well, she's probably just tired. But he didn't bother to go look, because you would wake up if someone's jostling you taking your vital signs, right? Well, then breakfast came. The CNA sent up the patient for breakfast. Patient didn't wake up for breakfast. So the CNA went and told the nurse again. She didn't wake up for breakfast. Again, he said, maybe she's tired. Well, by 11 a.m., the patient still had not woken up. Guess what? She'd had a massive stroke. She ended up passing away a couple hours later because at 11 o'clock they finally realized, oh, this is a problem. So don't let that happen. You know, a change in your patient's condition is always something you have to pay attention to. All right, so I'm sorry, I got off on a tangent. There we go. Now you see how I am? All right, so assessment, I'm still on page 2 here. Assessment, the collection and processing of data. Planning is really important. It encompasses the collection of health status information, and it's used by the nurses. The nursing care plan provides direction for individualized care and assures that the delivery of accurate safe care through a definitive pathway, and promotes the client's and the supportive person's progress. Also, it talks about upon completion of the LVN program, you will collaborate with the RN and you'll be doing revision of the patient care and actions based on established nursing diagnosis, protocols, and assessment. You'll utilize your knowledge of normal values to identify deviation. So lab values, very important. Is it within the normal range? Contribute to the formulation of a nursing care plan. Your knowledge of taking care of that patient personally will help the care plan. Maybe you know something that patient likes or doesn't like that you can relay through the care plan so other people know it as well. Prioritize nursing care needs of clients. Assist in the review and revision of the care plan. Modify client care as indicated by the evaluation of stated outcomes. Caring interventions. This is important because caring interventions are those nursing behaviors and actions that assist clients and significant others in meeting their needs and the identified outcomes of the plan of care. You should also demonstrate a caring and empathic approach to the safe, therapeutic, and individualized care of each client. Provide and promote the client's dignity. Honor the emotional, cultural, religious, and spiritual influences on the client's health. Provide competent, safe, therapeutic, and individualized nursing care in a variety of settings. Implement the prescribed care regimen within the legal, ethical, and regulatory framework of practical vocational nursing practice. Assist the client and significant support persons to cope with and adapt to stressful events. So remember, you're not just taking care of the patient. You need to also help the family, and the family needs to help their loved one. So the more knowledge, and I'll say it many times, knowledge is power. The more you know about the patient, more you know about the disease, the more you can help the family cope and the patient cope. And always try to solicit patients helping themselves, because that helps build their self-esteem. And also have the family help, because that makes them feel like they're helping and caring for their loved one. Also managing, I'll let you read through, but these 2 pages on page 2 and 3 are important to know. The behaviors, care planning, interventions, and managing. So be sure you read through there. All right, let's go on to essential knowledge and skills. So it guides the nursing assessment, planning, intervention, and evaluation. This kind of fits into the ADPI type of thinking that you probably learned in fundamentals. Assessment, diagnosis, where you get a nursing diagnosis, then you make a plan, an intervention, and you evaluate. You also will practice requiring knowledge of pathophysiology. How does the body work? How does the disease state work? How does the disease manifest itself? What are the complications that can occur from bed rest? Just bed rest. Treatments that you may give or that could be given. Remember, not only are you going to follow the orders, but you are going to make recommendations to the physician based on what you see. So you are invaluable to a physician who can only make it to a facility sometimes once a month. So you're going to be their eyes and ears and help them understand what's going on with the patient. Also, nursing interventions, expected patient responses to what you do. Is it a normal response or an abnormal response? Or was it a response at all? You're going to learn about pharmacology. And you're probably in a pharm class now, right? That you'll have on a Friday. And you'll learn about medication administration, the 6 rights of giving medication. Okay. I say 6 rights because one of them is documentation, very important. So what are some ethical considerations? Now we're getting into some stuff. Interesting stuff. So ethics defines within a group what actions are right and wrong, ethical, and whether the motives and outcomes of those actions are good or bad. Morality is closely related to ethics, but is an individual's foundation for rules of action. It's your morals. Values are specific beliefs and attitudes that influence the choices a person makes. So, ethics deals with values relevant to human conduct that are specific to a group. For example, nurses have professional codes of ethics, and ethics is concerned with defining what actions are right and wrong and whether the motives and outcomes of those actions are good or bad. You can see that on page 4. Talks about that. Ethical considerations. Also want to have you be sure and read the boxes. So those are invaluable in this book, I've found. And the cultural considerations, any care plans that you come along. So don't just think it's the text that's important. There's a lot of boxes and tables that are really important here. And here's one on page 4 right now. Key steps in the resolution of an ethical dilemma. So you might read through those steps of resolving an ethical dilemma, a personal ethical dilemma. And you know, when you have ethical problems or medical issues with your patients, who do you talk to about it? You talk to other nurses. Nobody understands nursing like another nurse, right? You can't really talk to your family members because you don't want to give any HIPAA information away. And, you know, they don't really know the situation that you're in at the moment. So talk to other nurses. It will really help. So remember about ethical considerations. That's important to know. So what are the principles of ethics? Now I'm on page, if I want you to follow with me here. So it's the middle of page 4 under box 1.1. Principles of ethics. It's about the middle of the page under ethical considerations. So principles of ethics and values can guide you when faced with situations that do not have simple solutions. Those principles include, now these are important, autonomy. Autonomy is where you respect an individual's rights. So a patient has autonomy. They have control of their personal rights, and you need to respect them. If they want to keep an egg under their bed for good luck, then they keep an egg under their bed. It's not hurting anybody, and it's their right. So, beneficence. You're acting in the patient's best interest. Justice. Consider fairness, equity, appropriateness. Now, this is a great word, non-maleficence. If you think of that movie Maleficent, you know, that evil witch, well, you don't want to be like her. This is non-maleficence, okay? Do no harm. You're going to do no harm to your patient. That is your creed. You never want to do anything that's harmful. Confidentiality. You want to protect patient privacy, HIPAA. Veracity. You want to be truthful and honest. So values that have been identified as essential for professional nurses also include altruism, equality, aesthetics, freedom, human dignity, justice, and truth. So those are just below where I was reading about the principles of ethics. So I want you to now look on page 5. The very top of page 5, it talks about nurses need to be aware of the tendency toward ethnocentrism. Now that's important to know. Ethnocentrism. Mark that in your book. Commit this to memory. What that means is it's the belief that one's own culture and its values are superior to others. So that's one thing. It's hard because I know you're raised a certain way with certain beliefs and customs, but you've got to know that there's other people that have other beliefs, and we have to give them dignity, and we have to take their beliefs into consideration. We can't judge them by our beliefs, right? So we have to always be aware of ethnocentrism. So that's an important word to remember. And right underneath that, it talks about cultural considerations. And it talks about, what does culture have to do with values? Well, ethnocentric beliefs, your own personal beliefs that you think are so great, about issues such as drug use and sexual orientation can influence a nurse's attitude toward patients so subtly that he or she might not even be aware of it. Values clarification helps nurse to be aware of their own values. So please take a consensus of your beliefs and values. And that's fine. Whatever you believe is fine. But don't try to push them on someone else and accept someone else's beliefs. You're going to come across a drug addict. Maybe you don't believe that's right. An alcoholic. Maybe you would care not to take care of an alcoholic because you don't drink. You know drinking's not good, and it's not. But if a patient chose to be an alcoholic and to drink themselves to death, who are you to judge? You're not the judge and jury. You're there to take care of them the best that you can with dignity, right? So there's also something called values conflict, which is also an ethical dilemma. In your book, it calls values conflict, which is right under that cultural considerations. It's also an ethical dilemma, a conflict between the ethics of the profession and a person's morals. So always try to understand the other person's views when you're caring for a patient. One day I had to take care of 2 patients. I was in the ICU. One patient was dying of leukemia. Young man. I was giving blood, trying to take care of him. It was pretty intense. In the other room was an overdose. So I had a dilemma. It wasn't an ethical dilemma so much. It's just that I felt like this person with leukemia wants to live, has everything to live for. And then in the next room was someone who just tried to take their life. And they were acting goofy in the room too. I mean, normally goofy, not just from the drugs. But it's like, really? This guy would give anything to live, and this guy's trying to take his life. So I had to wrestle with that and run from one room to the next, but giving them equal care. So you are going to find these kind of instances where you just do what you have to do, right? All right, so let's get into legal considerations. So, laws define the functions and limitations of nursing practice. Major legal risks in nursing practice, a tort. So know what a tort is. A tort is a civil wrong against a person or property. Malpractice is the term for professional negligence. Now these are really important in the nursing, because negligence is something that can be brought before the board. If you're negligent in your care of your patient, you can have your license taken away. So let's look under the legal considerations in your book on page 5, where it talks about nurses in all specialties are at risk for committing a tort, which is a civil wrong against a person or property. And here's some examples of a tort. Threatening contact without patient's consent. Restraining or medicating a patient against his or her wishes. If a patient says no, it's no. You can come back later, maybe they'll change their mind, and sometimes they do, or you can explain why it's important that they take their medicine, but if they say no, you can't force them. Invasion of privacy by sharing or publishing personal patient information. Don't take pictures. Don't post anything on Facebook, Twitter, or whatever else you have, TikTok. Giving false information that can damage the patient's reputation. So maybe you're seeing someone without their clothes on, and you want to make fun of the way they look. That's destroying their reputation, right? Let's say it was a judge, but you saw him in a weakened moment of illness. So that is a tort. You're defaming them. Professional negligence, and this is all on page 5 under legal considerations. Professional negligence is called malpractice. To be found liable for malpractice, the following conditions must be met. The nurse owed a duty to the patient. The nurse did not carry out that duty. So let's say you you have to clamp a Foley so that you can instill medication. Oh, it's time to go home. You don't unclamp that Foley. You did not carry out your job. You put that patient at risk. You could get in a lot of trouble for things like that, because you owed that patient to do the right thing, even if you had to stay over, right? Because the patient could get injured, and because of your failure to carry out that duty, it's malpractice or negligence. So I want you to notice also at the end of this under legal considerations where it talks about examples of negligent acts that result in lawsuits against hospitals and nurses. Failure to monitor a patient. You need to monitor your patient. Failure to document your findings, normal or abnormal. Failure to notify other staff of changes in patient status. Change in condition, so important, even if it's the way they act. I recently had an ex-student who the patient was up walking around, but started seeing ants. Well, that's not normal. But she wasn't hurting anybody, wasn't hurting herself, but it was a change in condition. So It turned out the patient was retaining CO2, was a COPD patient, and they were hallucinating because of their CO2 retention. So, change of condition. If she would have just ignored that, that patient could have died later. Failure to maintain or correctly use equipment. So, oxygen. The curtain goes up against the exit valve, or the patient isn't wearing their oxygen correctly, or your suction machine. Or, here's an instance, I had a CPAP machine. Patient came from the hospital. I was doing clinicals at the time, and CPAP machine got cracked. Well, we tried to tape it up, but the family member needed to bring the equipment that wasn't cracked. The patient could have died in his sleep if we left that equipment faulty. Failure to follow the 6 rights of medication administration. Failure to convey discharge instructions appropriately. So when you send a patient home, they need to know exactly the direct instructions. Failure to ensure patient safety. Be sure the rails are up, or the bed is in low position, or they have their call light. Or they need to be propped with pillows, or they need to lie flat in bed, or they need to have their head of bed elevated. You need to know what the patient needs. And failure to do what they need can be a consequence. Now, how do we avoid this? Well, this is also in your book if you read a little bit further, and it says, the nurse's best protection against negligence and malpractice is to adhere to the standards of care. Nursing students are held to the same standard of care as a licensed nurse. Now, what that means, let me just read a little bit further here. Students should never perform care for which they have not been prepared. So, clinical. If you haven't done something, you need to read up on it. You need to let your instructor know that you don't know how to do this, because if you do it and you do it wrong, you're held for that faulty performance. So you're held to the same standard. If you take the risk of doing something, you better do it right, right? So that's why your instructor's there. Use them and learn the right way to do something. Don't take a shortcut. Do it the right way, and you'll be good. All right. Sorry, talking a lot. Leadership and management. So the broader and more future-oriented leadership is, it creates a mission for the group to work towards. Management is more local and task-oriented. So when you're a leader, you have to look over people, right? And you're looking towards the future. What are we going to do today? What is our goal for the day? Or what is our goal for the week? This is how we're going to get there. That's how you create a mission. Management's more local and task-oriented, and it focuses on the day-to-day work of the organization. It's all important, all very important. Okay, you're going to hear me ruffling pages here. So I want you to take a peek on page 6. There's a couple of boxes. Remember I told you how important boxes are? So on page 6, it talks about the leadership and management, and it has those words in good letters that you can read about that. And then characteristics of an effective leader. Effective communicator, consistent in managing conflict. So I want you to read through there and know what the characteristics of an effective leader are. Also, making assignments and delegating. I think that's on the next slide. Let me go there. Yeah. So assignments, if you had to make an assignment, you give a task to others. Now, the best way to make an assignment is to know the strengths and weaknesses of the people that work under you. And that way you can delegate to the best of your knowledge. You're delegating a job to someone that you know knows how to do it. You don't want to delegate to someone who's never done that before, right? Because if you are the leader, you're ultimately responsible. And you also make sure that those tasks are carried out. Now, your NCLEX again is going to talk about delegation. This is when you graduate and you take your board. But they want to know you know how to delegate. So let's start learning now. Delegation allows nurses to accomplish nursing care for more patients than one individual could provide alone. Right. Another thing I want you to look at is the next box, coordinated care, essential elements of effective delegation by an LVN. So compliance with the State Nurse Practice Act. So you're not going to delegate a job to someone who that's not their job, right? A CNA should not do a blood sugar. That's an invasive procedure. So you want to be sure and delegate to the right people. Knowledge of specific condition and needs of each patient, knowledge of training and background of individuals to whom tasks are delegated. So maybe one of your nurses under you is great with Alzheimer's patients. Well, assign that patient Alzheimer patients. Assign that nurse, Alzheimer patients, because she's the best at taking care of them. So you'll learn that everybody's strengths, and everybody has one. But as a good manager and delegator, you will delegate those jobs to the right people. All right, so always to remember, and this is under coordinated care, documentation of the outcomes. So what did you do? What did your CNA do or your other nurse do? And how did it come out? Oh, let's just talk about it here for a minute. One of the ways that we document is in an SBAR type of form. You hear me shuffling my pages. Okay, so SBAR, situation, background, assessment, resolution. So, and it's right here on page 7. One systemic communication is called SBAR, situation, background, assessment, recommendation. If you stick to those kind of thinking, you'll always think the same way every time and you won't forget anything. SBAR facilitates the exchange of important information between professionals. It may be used to alert physicians. So when you call a doctor, you need to be really organized. You want to give them the situation, their background, because the doctor doesn't know everybody perfectly. Your assessment of what happened or a change in condition, and what do you recommend? If your patient's leg is swollen and you've got a 3+ pitting edema, maybe you want to recommend to the doctor some Lasix. So it can be recommendations like that that they really will thank you for, because they can't be there. You're their eyes and ears. Okay, conflict Now, conflicts can arise from differences in many personal factors and may also be caused by unclear roles. It can create stress and negative feelings that can adversely affect the work situation. LVNs in leadership or management positions must be able to facilitate conflict resolution. Now, there is, if you look in your book, under conflict resolution, it talks about 4 stages of conflict. First one is frustration, conceptualization, which means that it's a perception. You're perceiving your concept of the situation. Action, the conflict leads to various behaviors that may or may not resolve the conflict. And then the outcome. Is someone going to win and somebody lose? Or can we all come out the same? So identifying the root cause of the conflict and related prior history before beginning the resolution process is beneficial. Okay, now what's really important here is the modes of conflict resolution. So we need to know the positive and negative outcomes and when to use each one of these types of conflict resolution. On page 7, so the first one is accommodation. You shift the care of 2 residents to other CNAs. So let's say your CNAs are arguing. So you want to separate them. Don't have them keep being in the same area where they can keep having conflict. Put one in one end and the other in another end so that they don't keep conflicting. Collaboration. You reassess the needs of each group of assigned residents. Recognizing that Alice is correct, you work with CNAs to identify more equitable distribution of assignments to ensure good patient care. So you collaborate with other nurses for the best outcome. Compromise. So this is using a person's name. You tell Alice that you will alternate CNAs assigned to that group of residents. So it's a compromise situation where you just pick the best compromise. You know how to compromise, right? You probably do it all the time. It's not your way or their way. You can come to a compromise where it's acceptable to both people. Avoidance. You tell Alice that you have more important things to deal with right now and go to your office. That's avoiding the whole situation. That's not good. It's not really resolving anything. You're avoiding conflict resolution. Competition. You tell Alice that everyone has some residents who require a lot of care. So you have Alice comes to you. I've got so much work to do. I can't do it all. And if you just say, everybody's got a lot to do. You're no different. Everybody's working as hard as they can. That's not really helping Alice, is it? So for each of these solutions, think about the positive and negative outcomes. So it's really good for you to read through these modes of conflict resolution and know the positive and negative outcomes and when to use it. Do you use it? Maybe you use some of these in your everyday life. And how's it working for you? Or maybe you've seen someone do this and you've seen how it turns out.